Hello and welcome to this extraordinary interview with Danica Thornberry. And today I want to introduce her as one of the first acupuncturists in America to specialize in women's health and infertility. She has helped well over 1,000 women conceive healthy babies. And since 2001, she worked with Los Angeles' best fertility specialists, appeared on Lifetime's TV speaking of women's health, and she's received the Award of Excellence in Family Building from the online support group Resolve Infertility. Danica is the founder of Well Woman Acupuncture and the Seed Fertility Program, an online course that she's designed to help women optimize their bodies and spirits for motherhood. She lives in Los Angeles with her 2 against the odds children. So without further ado, welcome, Danica. Thank you for being here today.
Thank you, Kirsten, for having me. It's an honor to speak to your audience today.
Awesome, awesome. So let's jump into the first question. We would love to know, what was your greatest inspirational motivation, or what has made you leap into this path that you're on right now in terms of helping and serving the women and people that you do?
Sure. Well, it would definitely be that motivating factor of a personal experience.
Amazing, isn't it?
It is amazing what will happen when infertility brings you to your knees, when you think that you have your own plan and you have things figured out, and then all of a sudden you're told that something that you've maybe taken for granted is going to be taken away from you. So as that was the case for me 15 years ago when I was 31, I was told I wouldn't be able to have kids of my own because I had a very high FSH score of 21 points and a blocked fallopian tube and stage 4 endometriosis. And I wasn't with a partner. So I had this this situation kind of presented to me. And the way that I tackled that situation was not to give in to the fear of what the doctors and the tests were saying, but rather to look at what did I believe about this situation and how to merge the wisdom that I had from working with my patients and helping them to beat the odds, to have that become my reality, that I wasn't going to be boxed in or depleted from fear thoughts. I was going to somehow rise above the fear. And that's been my inspiration. I try to help other women find that courage, even when it's really hard to do it. When it's really scary, that's probably the most important time that we have to find courage.
It is. And the more I do this, the more I'm finding that women seem to have, there's something innate within all of us that when you can tap into it, it really, it is so powerful. And yeah, so.
If I could add something to this idea that we have to be powerful and we have to fight infertility, I think that is not that helpful, as there's a power that comes from being courageous and wise, and that brings peace inside the woman, and that from that peaceful warrior stance, that's where the changes can happen. Because if we're fighting and having something to prove, I think we might set ourselves up for inflammation, autoimmune infertility, and then we create an even more challenging situation. So it's for each individual woman figuring out how can she be a peaceful but powerful advocate for herself. Yeah. So that's why I came up with the name Well Women Acupuncture, because it needed to be broadcasting what's going on inside the rooms. We're not talking about just racking up a number of pregnancies. We're talking about creating a holistic mind, body, spirit experience. So
Yes, yes. And so would you see it as how do you deal with the women that do come to your practice? Like, I'd say that it wouldn't be an all one size fits all type approach, seeing as we're all sort of different beings, or would you have a kind of approach that is similar for each woman going through the journey?
Sure, that's a great question. My one size fits all mindset is that if they find my office and they make it inside those doors, then everyone there is going to be addressed from the perspective of what's going on spiritually and emotionally. And then on the more individual basis, I address what their dietary needs may be, what supplements might help, what acupuncture protocol we would be using based on their individual pattern. But for the most part, these women come in and I use that as my opportunity and their opportunity to have some spiritual educating, because I believe, at least over here in the States, the women are starving for some spiritual conversation. So I love being able to offer that to them. So that's the blanket part of the treatment. And then we whittle it down based on what is the diagnosis, what treatments has she done already, what's her diet look like, and what's her relationship like. So then I can kind of make it more individualized.
Beautiful, beautiful. And would there be like a kind of a reclaiming of self, do you think, for a lot of these women? Do you think
Yes,
that would be part of it too?
Yes, absolutely. And I have said this before, helping well over 1,300. I don't even know how many babies have come from this, because they go on and they have multiples, or they have siblings, and they don't let me know about that. They're way too busy. So women who have come in who were worried they wouldn't be able to have one child now has 4, right? So I don't find out about that, and it's hard to keep track. But the one compliment that will stick with me forever was the day that a husband came into the office, and he looked around and he said, "I don't know what goes on in here, but thank you for giving me my wife back."
I've got goosebumps all over my body.
Yeah, because we do lose ourselves to the fear.
Yeah, yeah.
Or it's easy to get lost in it.
I think there's like an attachment to this wanting to have a child, and I think maybe the reclaiming is actually more about going back into our heart and finding out what's important for us, and asking those important questions about, are we doing this because we want to do it, or are we doing this because we're told that we have to do it, you know?
Right. Asking the question, what does the baby represent for you? Because if it's going to be the source of your joy, then there will be something that challenges it even when baby gets here. It's about finding what you think baby represents and finding that appearing before getting pregnant. And then I think we create that open space for the baby to come in.
Beautiful. Yes, absolutely. So I've got a question then, and it is a fairly delicate question, but I do like to ask the question because I think it's kind of pertinent for people who are going through maybe some, you know, whatever the struggle is at the moment. Do you think that there's a potential benefit to going through the infertility or multiple miscarriage or the age question, you know? Do you think that there's a potential benefit for the couple or the mum to not having that straight away?
I do, but I like that you're presenting it as a delicate conversation, because we're talking about something that can be chronic, something that can be heartbreaking and shattering to that woman or that couple going through this process. So for us to sit here, me with my 2 against the odds children, and to say that it's a benefit, I call it an opportunity, actually, an opportunity to find more personal power, to find more self-love, to find out what we really believe about life and our lives in particular. I think it creates this change in attitude where we have more of a higher understanding of what is going on for real. And that's not conversation for everybody, but for the women who are taking a mind, body, spirit attitude, for us to have this summit, for you to put this together, for us to have this conversation where we're saying, you know what, there really is a benefit, there really is an opportunity in here, but it's very deep in emotional pain, in chronic disappointment, in medical bills, in a lot of tears. But if you can push that stuff aside and you can really open your mind and ask, what is the lesson here for me? What do I need to learn? What kind of wisdom have I learned from this experience? What's my takeaway here? Because babies turn into teenagers and then they leave the house, but we're left with ourselves ultimately. So what's the message? Is it about forgiving something from the past? Is it about loving the self more? Is it about embracing change? Because some people really hold tight to things that they believe in. Yeah. Like, what is it about? And I guarantee you, it'll be the thing that's the hardest thing.
Of course.
Yeah. So if we get on that spiritual path and we can elevate our thinking to this place of, okay, I don't like challenges, but when I realize that what the challenge is, and I bring my powerful, peaceful warrior mentality, then things do shift. And that's when miracles happen. So.
Oh, I love that word, miracles. I really do. And then maybe we'll just ask that question straight after this one, is then giving some hope to the people that are struggling at the moment. Can you give us an example or two of a miraculous story that you have seen, so that people can have some hope and see that there is a light at the end of the tunnel?
Thank you for giving me the free rein to speak about 2 cases, because I've been thinking about that through the week. How would I narrow it down to just one? Having seen so many miracles and having 2 of my own, I think that they're all miraculous. So I was thinking to share these 2 extreme stories where I have seen women not only miscarry or lose a baby late in the pregnancy, like at 24 weeks or a stillbirth, but to go through infertility and have a baby who, this particular example, and I've seen this a couple of times, where the baby is taken to daycare, and at 9 months, the daycare, for convenience sake, is still swaddling the baby. And a 9-month baby really is beyond swaddling. And in this particular case, the woman, that was against her better judgment, and she told them, I don't like the idea of the swaddle for my 9-month-old. And they said, oh, you're just worrying too much, until the day that the daycare called and said, your baby isn't breathing anymore. So that woman had to reconcile her anger and the blame and the grief. And ironically, she conceived soon after the loss, but then she wanted to give that boy a brother. She wanted, and the way that it took over her personality with the attempt to get a sibling for her second was robbing her child of love and attention. And it was then that she came to see me, and we were working on forgiveness, and I was bringing to her attention how she was letting the grief and the anger become her identity. And I don't think that she liked to hear that, but I needed to say that to her. And we really worked hard on forgiveness, and she ended up conceiving at the same time that adoption proceedings went through. So she got 2 kids at the same time after she opened her heart. And that particular case, and I've seen a woman where her 18-month-old wandered off into the pond, and she thought that she was with the nanny, and the nanny thought that she was with the parents. So tragic things happen after the babies get here. But then I have another woman where she tried for 18 different IVFs. 6 of those were using donor eggs, and nothing was changing. And her doctor here in the States told her to come and work with me. And we addressed some of the issues that had gone on in her life through the 18 attempts, and how angry she was because the problem was actually not her eggs, it was her sperm, but it was her husband's sperm, but nobody was talking about that. So again, it was this issue of anger and blaming somebody else. As I helped her to realize that that was something that she would have to forgive ultimately. And as she forgave, then we could identify that as something that was changed, where the other 18 attempts didn't have that forgiveness piece.
Yes.
Suddenly, she conceived in that cycle.
Wow.
That in vitro, and got twin boys from that.
Wow.
So, there is really something to be said for how long we hold on, and how important it is to surrender to that big lesson that keeps hitting us on the head and hitting us on the head. Or the things like in the other 2 examples, that heart-wrenching pain, which both parents, the one who lost the toddler in the pond and the loss of the daycare, both of them, when they went through the path of forgiveness, they did receive another healthy child.
Yes.
So
yeah, I mean, the process can be such a painful one, and I think a lot of it is to do because sometimes we just don't know what the problem actually is, and yet when it comes to our awareness, it really is a split second, isn't it? It's that awareness, then it's like, okay, yes, I think I'm ready to forgive and let go and surrender, and the magic is like instantaneous, isn't it? It's not like there's this process that has to start all over again or anything. So there is beauty in that,
Yeah. I like to remind the women that I work with of something that always works, if they are happily married, at least. I will remind them, there was a time where there was a guy before the guy, or dating many different guys, and you began to wonder, maybe I won't get married. Maybe this just won't happen for me. Maybe I'm not meant to. And then they accept it. And when they move into acceptance, then their situation changes. And then somebody that's really perfectly matched for them shows up. So if I can remind the ladies, hey, that's one place in your past that you can look to and pinpoint as a time where you were not left out. You got your wish, the miracle happened. So look back and ask yourself, what were you doing back then?
Yeah.
Were you crying and being scared all the time, or did you just surrender and you were kind of over it? And it is quick, and it does make a big difference. So yeah.
Perfect. Yeah. I think people do need something to tap back into, to know that there's a similar kind of thing in our lives always,
Exactly. It's very hard to trust when you're scared, but if you can look back to something that worked out. So even if it's women who are doing this alone, if they can look to when they landed a job or when they passed a bar exam or something like that, where they were scared and they were pushed to the edge of the cliff and everything worked out, then they can fall back into that when they need to right now.
Yeah, perfect. So let me just ask if there's anything else that you would like to add that we haven't covered in this interview at the moment.
Sure. I think one thing, you had asked me to think about what I feel is the biggest impediment to fertility right now. And I think it has to do with the racing through life and overstimulation, whether it's from our cell phone, mobile device screen, or too much caffeine and sugar in our food and coffee drinks. But I think that as we are overstimulated, we're having too much adrenaline in our system. And as I started the conversation, that's not the peaceful warrior, because that adrenaline gets us so far away from the wisdom of our eggs in the first place. The eggs are not sperm. The sperm can be overstimulated and race forward, but we really have to be receptive and trusting through this process. And so that's like my thought on one of the major contributors of the problem for women. So they need, if they're watching this, they want to be thinking, is that true for me?
Yeah, I have to agree with you on that. I think we have a lot of focus on getting things perfected, and things, and life is quite a rush. And even the baby thing, it's come on, it's time now, it's time. Yeah. Got to get on it. So so it is that coming back to self and allowing that energy to rest and do what it needs to do.
Sure, because the come on, get on it has the flip side. I'm afraid it's not going to happen for me.
Yeah.
And fear, my teachings include, they're not just limited to Chinese medicine. It's this idea of energy centers, the chakras. And the second chakra, that's where all the reproductive energy is, that is weakened by fear. Yeah. So ladies watching, look at the fear in your scenario and see if you can pull it back some. That would be my advice to the community.
Yeah, and a whole lot of love, and a whole lot of love, self-directed love,
understanding. Yes, yeah.
Yeah.
Yes, choosing to love ourselves and the lives that we're creating creates a nice cushion for the baby to land in.
That's beautiful.
Yeah, if we think about it from that perspective, that's much more receptive. And that the uterus being the second heart, if we have a bunch of fear and trauma in there, then that's where we want to start and reconcile that and release through writing, through therapy, through crying, through talking with trusted friends, and with always the intention being to clear that space and make it open.
Oh, beautiful words of wisdom. Thank you, Danica. honestly, really beautiful. I think we're sort of coming to the end of it now. So maybe you have a special gift for people who have joined today. So I'd love you to share that, please.
Okay. So I have created a beautiful online program called Seed Fertility. And it's a personal discovery course that also contains a dietary component. But the free gift to the viewers of the summit today is a full-length movie that I've created. And it has, we take one woman's story who, I don't want to spoil it, but she lost a baby at 20 weeks. She received bad news and had to make some very hard decisions. And then we let her story unfold. And I teach, it's actually a film that was taught at one of my live classes where I'm explaining what's happening in the woman's mind and her physiology during the fertility cycle. So for each week of the menstrual cycle, there's a mindset. And when the women understand that and they do the work that's happening in that particular phase of her cycle, then she ends up at the end of the month in a more balanced, receptive, ready attitude that's oozing with the self-love components. So that 43-minute movie is my gift to Summit viewers. Wow. And they can find it by going to seedfertility.com/free gift. So I think that they'll really enjoy that. At least that's my intention. And I think when we start thinking about infertility differently and we open up a conversation for another way that it can look, like an opportunity, some things to learn about, some things to change before, then it doesn't have to be heart-wrenching and something to be ashamed of. Yeah. I know, this is the beginning of those conversations, but the time is coming to have them. So yes. It's brave people like you who undertake a summit like this that's blazing the trail for the women. So Kirsten, thank you so much.
Well, thank you.
And taking it on.
Well, thank you for sharing your message today, because I know for myself it's been really enlightening, and I know that people are going to love that beautiful gift that you've shared with them today. And so you have all the links and all that in the email that we sent out with this interview. So do get in contact. And yes, Danica, thank you so much for your time and energy today.
You're welcome. It's my pleasure.
All right.
Thank you so much.
Okay. We will see you soon.